Good afternoon. Today's April 24th, 2020, and I'm Rob Brandt, CEO of Mountain View Medical Center, and I'd like to give you an update here with Eva Kerr, our County Health Officer, on our status with COVID-19. How it stands today, we have not done a test in our community for 2 weeks, which is a good sign. We still have plenty of tests available for those that qualify. We have 34 tests in-house that we could administer, and we have a new exciting test that we can find if you have developed antibodies. So we are going to open that up to the public starting Tuesday of next week, and you can call our clinic at 547-3321 and schedule a visit to our lab to get the antibody testing. It's a send-out lab for us, so the results will take 4 to 5 days at a minimum, and we have to send those to Mayo Clinic. This test will tell us if the patient has developed antibodies to COVID-19, and it'll help paint the picture of what's happened or happening within our community. So I urge you to take that test if you feel as though you'd like to know what has gone on with you personally as a patient with COVID-19. I'd like to talk a little bit about our hospital operation and our masking procedures. When you come into our facility, don't be alarmed that the employees have masks on. It's just our policy and our procedure right now as we step through this to help protect all of our patients. And when you come in through the clinic, we'll ask that you have a mask on, and if you don't have one, we'll provide one for you. Like I said, it's purely precautionary to try to protect you as our patients as well as our employees. So please follow those guidelines. And another big thank you to our entire community. We have done a phenomenal job. I know everybody's really wanting to go out and enjoy the nice weather and get back to normal. But as Governor Bullock revealed, our opening in phases, it'll take a little bit of time and we'll have potentially a new normal. But really want to thank the public and all the businesses in town. Again, thank you so much for everything you've done. You've helped keep our long-term care residents safe, the healthcare workers within our community safe, and I can't thank you enough for everything that you've done. So, Eva, can you tell us a little bit about our reopening and how that's going to work?
I can, thanks. I want to talk about phase one, and I really want to hit home that our vulnerable population, our individuals who are over 65, with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, or who are immune compromised, they can still stay home. There's nothing about phase one that says we need to get out, we need to be more active if we don't feel comfortable doing that. There are still going to be services available for curbside, for delivery. All of those things I think will still stay in place. So I'll really encourage you to, as the next few weeks go on, if you are in that population, please do try to stay home if you can, especially if that is where your comfort level is at. We do ask that you wear masks. That's a recommendation of Bullock if you are out in public, if you can't be 6 feet away from people. Guideline a couple days ago was pharmacy. If you're going into the pharmacy, the CDC guideline is to wear a mask to go into the pharmacy. I talked to Nicole Saraday today about that. She said, yes, that'd be great if people would wear masks to come into the pharmacy part of the store, especially. If you do not have a mask, there are options to get masks. Otherwise, you can still use the delivery and the curbside service for pharmacy. She will continue those services, I'm sure probably for as long as needed, and I believe they've been doing that way before COVID-19. So with the phases, the big ones are the bars and restaurants. We are still waiting for food and consumer safety to kind of give some good tips and stuff on the cleaning and the training. Each business has to have a plan kind of in play of how they're going to handle the situation. I know a lot of it's confusing and it's frustrating, and we can't use the bar, but maybe we could use another little section. Hopefully they're going to answer a lot of those questions. We were hoping that was going to be out by now. It's not out yet. They are working hard at the state level to get that done. As soon as it gets out, Sean, our sanitarian, and I will review it, and it's going to get pushed out to every business. Really excited to work with the businesses to get everything up and rolling by May 4th, the restaurants and bars. and hopefully you guys will have really good success getting opened back up. I know it's hard. It doesn't look the way that you would hope it would look for getting reopened at half capacity with some of the restrictions, those sort of things. So, but I do want to work with everybody on that so that we have as much success as possible for the businesses to get reopened. Other businesses as well, please call if you have questions. The curbside service ones that are going to start opening back up, and that if you've got questions in that, please holler. The hair salons, those sort of things, will definitely work with you. Governor Bullock also spoke about minimizing non-essential travel. Continue with that. Returning residents to Montana or visitors still need to self-quarantine for 14 days. That is a recommendation of his at this time. So please do follow that one. Phase 1 is going to be phase 1 as long as it's needed. There is not a hard and fast answer to that one of when we move to phase 2. There'll be a lot of research done. We'll be waiting to see how more cases happen or how things go. So please just be patient with that. Hopefully it will be a smooth transition to phase 2. Rob talked about it too, but at this point, senior living, and that is still closed to visitors during phase 1, and I also believe during phase 2 as well. It's probably going to be one of the last things to open back up. We know that's a frustrating one, and we are doing our best to try to protect our vulnerable population in the nursing home, long-term care area. As church services open up on Sunday, I have talked to a few churches, a few more that we need to communicate with, but Dr. Brunston and I really hashed that one out and really felt like if you are in that vulnerable population, you don't need to, you could stay home for these first few weeks. Hopefully they will offer some video or some other options. There's going to be a lot of people gathering in a small area while they kind of work out some of those things, and so really want to encourage the vulnerable population to stay home at this point as much as possible while phase 1 starts to go through. Please call if you have symptoms of COVID-19. Please continue to do that. We still want to test people. The phone number for the hospital is 547-3321. And that's not going to change. If you have a fever, cough, shortness of breath, please call in. They will screen you. They will decide if you meet the criteria for testing, if you need to be seen in the emergency room. However, the best way to take care of you will be done. The school is going to continue distance learning. I think most of us are aware of that. They are still going to deliver meals if you signed up for that through May 21st. A good site to go to find all of the governor's stuff is covid19.mt.gov. We probably will be working with the restaurants and bars through next Wednesday. There's still going to be some more guidelines and some more things coming. At the local level, though, we are not going to go stricter than what Bullock has advised. So that's where we are at with that. I think that might be all I have.
Perfect. Thanks, Eva. Thanks for the update. And as we go into reopening Montana, as you can tell, Montana has been one of the most successful states through this process in the lower 48. And we want to keep it that way. So please continue to follow guidelines, use social distancing, wear masks when in public, and really try to protect us so we can go through these phases of 1, 2, and 3 rapidly, and we can get to a full opening and enjoy our summer. So I really hope that we can all do that. And as we get through some more of the data, especially when it comes to the antibody testing, we'll know a little bit more about what has gone on throughout our community. So please stay safe out there, and thank you again to everyone for all of your hard work.